I think it's really important to ask patients if spirituality is important to them. And I think a lot of people associate spirituality with being religious, and that's not the case. Spirituality is really about your connection to yourself, connection to others, and sometimes a connection to a higher power. But most people, especially when they're dealing with an illness, are looking to be connected to something much larger than themselves. So I don't think a physician has to have a particular belief system. All they need to do is be open and inquisitive and ask a patient if that is something that they want to be part of their care. One of the most profound experiences I ever had was and this predated my doing my fellowship, I had a family who was witnessing the death of their loved one, and they heard my last name, which in Hebrew means blessed, and they felt that it was profound, somehow, that I was the physician caring for this loved one. And so they wanted to perform a religious ceremony at the bedside and asked me to participate in it. And I didn't necessarily share that belief, but I was so touched to be a part of that process. And so we stood at the bedside, and she had not passed yet. She had a type of heart arrhythmia that inevitably would decline to asystole. And she was breathing very shallow and very, probably like a couple of breaths a minute. So it was inevitable that she was going to pass. And we stood at the bedside, and I just prayed with them. And we didn't do anything medically to her, and she came back. And she lived, and then had actually changed her mind about a medical intervention and pursued more aggressive intervention after that time. So it was really quite remarkable. I think it's those small experiences, when you're open to them, that you realize the power of those experiences. If you're never open to them, you're never going to have those type of experiences.